Hello, hi, it's Dr. Jeffrey Mark. Today I'd like to talk to you about preparing for the fall in a pandemic. The number of COVID-19 cases has reached over 32 million cases worldwide, with almost 1 million deaths at this time as we pass the fall equinox. In the United States, cases on average have slowed and are dropping in some states. In Europe, cases are accelerating, and in England, numbers have climbed almost to the levels that were seen in March and April. In France, they have surpassed their peak in March and April. Italy has not gone up as much, but still they are also experiencing an increase. In response, the United Kingdom will be changing rules for pubs and restaurants to close at 10 p.m. The UK's COVID-19 alert level was moved up to level 4, meaning transmission is, quote, high or rising exponentially, end quote. To illustrate what an exponential rise means and what it looks like, we can use the example of investing or monetary growth. In this illustration, which can be found on this website that's listed below, if you're offered a payout of $1 million up front, or to wait after 30 days to have a payout, a penny doubled every day for 30 days, which would you choose? As you can see by the graph, if you choose the penny route, for the first 25 to 26 days, you would probably have thought you made a big mistake by not taking the $1 million up front. But by the end of the month, you would have received $10,737,418.24 for your wager. So you can see that not much appears to happen until the last 7 to 10 days of the month, which is what the fear is with an exponential rise with COVID-19. The virus was likely growing quite slowly for some time, and when a rise starts to be seen, as in the UK, officials appropriately responded with increasing the alert level to 4. With the flu season coming upon us and winter following, there will probably be a spike in COVID-19 cases. The World Health Organization, the WHO, has acknowledged that almost 1 million people have died worldwide, and the fear is even if a vaccine were available today, by the time it took to inoculate and administer the vaccine to the whole world, another 1 million may die. The best means of decreasing both the spread and the chances of mortality are to optimize nutrition, maintain a healthy lifestyle, and following the CDC guidelines of frequent hand washing, wearing a mask, and social distancing. In a recent interview with Dr. Anthony Fauci, he told the interviewer that what he was doing for himself to maintain his health during the pandemic. His suggestions echo what I have been sharing with you these past 6 months. He stated he takes supplements in his own diet with vitamin C and vitamin D. He recommends getting enough sleep, maintaining a healthy diet, and avoiding or alleviating stress as the 3 most potent ways to keep your immune system strong. Here is a list of the blogs that are covering these topics that we have already discussed earlier for the past 6 months. They're listed below, or you can see on the description of this blog. In addition to doing everything we've outlined above, there may be certain behaviors that we can do or change that may also help. I mentioned briefly about a CDC review article that suggested an association with eating out at restaurants and COVID-19 positivity or infectivity. I wanted to go into a little more detail about this study. The study was a case-controlled trial, not a randomized placebo-controlled study, and it involved an equal number of men and women and consisted mostly of people from age 18 to 59. Only 18 were older than 60 and mostly were Caucasian. Most who were exposed to COVID were exposed to a family member, and almost all wore a mask most of the time. The investigators created a chart with the adjusted odds ratio and 95% confidence intervals for community exposures associated with confirmed COVID-19 among 314 symptomatic adults that were greater than age 18 in the United States from July 1st to July 29th, 2020. Because there was a lot of overlap, and without getting too much into statistics, the only variable with both the median and confidence ratios that clearly were above the adjusted odds ratio of 1, or being statistically significant, were the people who ate at restaurants. While it would be nice to know if those people had dined inside or outside, this information was not obtained or published. The conclusions were that findings from a case-controlled investigation of symptomatic outpatients from 11 U.S. healthcare facilities found that close contact with persons with known COVID-19 or going to locations that offer on-site eating and drinking options were associated with COVID-19 positivity. Adults with positive SARS-CoV-2 test results were approximately twice as likely to have reported dining at a restaurant than those who were negative with SARS-CoV-2 test results. The authors further stated that eating or drinking on-site at locations that offer such options might be important risk factors associated with SARS-CoV-2 infection. Efforts to reduce possible exposures where mask use and social distancing are difficult to maintain, such as when eating and drinking, should be considered to protect customers, employers, employees, and communities. Another paper from Japan supports the idea that closed environments help spread COVID-19. The article is in preprint, but the authors write that in the paper they, quote, show that closed environments contribute to secondary transmission of COVID-19 and promote superspreading events. Closed environments are consistent with large-scale COVID-19 transmission events, such as the ski chalet associated cluster in France and the church and hospital associated clusters in South Korea. Our findings are also consistent with the declining incidence of COVID-19 cases in China, as gathering in enclosed environments were prohibited in the wake of the rapid spread of the disease early on. Reduction of unnecessary close contact in closed environments may help prevent large case clusters and superspreading events, end quote. In the paper, they found that the odds that a primary case transmitted COVID-19 in a closed environment was 18.7 times greater compared to an open-air environment. So in preparing for this fall during a pandemic, we should all be aware of the probability of a spike in the number of cases, and that as a citizen of our country and the world, that we shouldn't let our guards down, but to continue to follow the recommended guidelines of frequent hand washing, wearing a mask, and social distancing. We can also help ourselves individually by optimizing our immune system through lifestyle changes, such as getting 7 to 8 hours of sleep, stress reduction, and getting 30 minutes of cardiovascular exercise daily. Foods containing vitamin D, vitamin C, zinc, and quercetin may help boost our immune system as well. Supplements such as Mitomax that contain N-acetylcysteine and many other cofactors help to optimize the mitochondria, also increase our energy production, and help mitigate oxidative stress. Lastly, making prudent behavioral choices like avoiding indoor gatherings or minimizing indoor eating with groups of people may also decrease the risk of infection. Hopefully, with these tools, we can all stay healthy this fall as we wait for more effective treatments or preventative measures, like monoclonal antibodies, aeronabs, or vaccines. Please see the blogs on www.allfunctionalhealth.com/blog if you're interested in any of the topics that are discussed above. If you have comments, questions, or want to learn how functional medicine can help with improving your gut, maintaining brain health, and optimizing immune function, call our office at area code 925-736-9828 or email info@jeffreymarkmd.com. For more information on supplements to boost your immune system, click on the link below or call our office at area code 925-736-9828. Or you can email info@jeffreymarkmd.com. So take care and stay healthy.